Hi everyone, thank you for joining us today. As many of you saw, we are going to start doing a weekday Facebook Live chat with you all, answering your questions about COVID-19. I'm Ashton Day, I'm a health educator here at the health department, and with us today we have Dr. Millham, and she is our medical director at the health department.
Thanks for having me here.
Yeah.
Thank you all for watching.
So before we get started, we just want to remind everyone that it's important to remember that COVID-19 is a new virus that everyone is learning about. The information that we are providing you with is the latest guidelines from the CDC, and we will continue to update as more information becomes available. All right, so we'll go ahead and get started. So a big question people have every day is how many cases do we have in Boone County?
Sure. So at this time, we have 8 cases in Boone County, and I know a lot of people would like to have a lot more information about those individual cases. Patient privacy is incredibly important for obvious reasons, not just legal, but because we care about human beings, and I know all of you do as well. We also recognize that providing as many details that are appropriate about those cases can be really helpful from a public health standpoint. So we will continue to share with you all the details that we are able to do, that we are able to share.
Yeah, and those case counts, you can find those updated every day, 10 a.m. and at 5 p.m. We'll be sharing that on our Facebook, Twitter, the Nextdoor app, and our website, como.gov/coronavirus. So how does COVID-19 spread? We'll just start with the basics here.
Yeah, it's a really good question. So it appears to spread by droplets, specifically large droplets, and so that's a big reason that social distancing is being brought up so often and has the ability to be so effective. So droplets meaning coughing, sneezing, secretions, those are the primary ways it's spread. Typically, whenever something is transmitted by droplets, it's usually you're within 6 feet of someone to be able to get that virus transmitted that way. So if you are handshaking or touching the other person, certainly there can be exposure that way. But again, it's droplet, and so that's where that 6 feet you keep hearing comes in.
Yeah. So if I am, within 6 feet of somebody and they cough, do I have to be worried?
No, not if you're. Oh, and if you're less than 6 feet.
Sorry, yes, less than 6 feet.
Sorry, that is what you said. I just was kind of processing that. So yeah, if you're within 6 feet and someone's coughing, hopefully they are coughing into their elbow if they don't have a tissue to cough into. It is unlikely that being near someone briefly and being exposed to a single cough, that would be highly unlikely that you would become infected from that particular exposure. However, that is how this virus is spread, and so that is why you want to keep your 6 feet of distance, is because that is potential, absolutely. It's just whenever you think about a single event, that is a lower risk. And that's why whenever we talk about close contact or a higher risk exposure, we think about close contact under 6 feet for a prolonged period of time.
Yeah. So you touched on social distancing, but if you could give a little more of why it's so important for people to follow those guidelines.
Absolutely. That's. I think this is a really important thing for us to talk about. Everyone hears these. They're almost becoming kind of like trend words or catchphrases where you hear social distancing and flattening the curve, and they are very related, and so the whole point of social distancing is to flatten the curve and to protect ourselves and the people around us, but in a broader picture, it's to flatten the curve. So the social distancing, the avoiding mass gatherings, avoid congregate settings, and keep yourself 6 feet apart as much as possible. That limits the transmission, so that in an acute time frame protects you and protects the people around you. On a broader scale, it slows the spread of the virus. And so a lot of us have seen those graphics of what it looks like pictorially to flatten the curve. So when you see a sudden spike in cases, and we're talking, those kind of spikes are typically thousands of new cases happening very quickly, very close together. It overwhelms the healthcare system. There is not an infinite number of hospital beds, and that is the scary thing that a lot of people are seeing in Italy that I think has created a lot of stress and worry here. And so I don't think that this is something that we want to panic about. I think this is something we can do something about. And so this is all about the knowing what you can do and playing a role in flattening that curve. This is something that we can still do, is flatten that curve here and make it to where we can handle the cases coming in by flattening that curve, having it slow down so that it's spread out, so that the new cases are not all popping up at the same time, and that way the healthcare system can keep up. That way there are enough healthcare personnel to see, evaluate, treat, provide care for these people. There are enough hospital beds that can house the patients who need hospitalization. I also think it's important to clarify that not every new case, when we see a spike, not every one of those cases is going to need a hospital bed. I think we've kind of seen the numbers pretty specifically that 80% of people will have mild to moderate symptoms. So it is not that everyone who gets ill will need to be in the hospital. It's that if you see thousands of new cases, chances are some of those people will need to be in the hospital. And so we don't want it to be more people needing to be in the hospital than we are capable of providing.
Yeah, and I do just want to mention, us at the health department, we have to work every day, and so if you notice, we are further apart than we usually would be, and the chairs behind us are spaced out. That's how we're having all our meetings. We're making sure we're practicing social distancing in the workplace.
Absolutely, that is, and it is an awkward thing for those of us that like to hug and embrace and handshake, but we are all getting used to it, and so keep doing that yourselves, and the more people do that with each other, then we kind of get used to it, and then eventually we will get back to normal and good interpersonal skills. But for now, this is the good interpersonal skill.
Yeah. So now that there is more testing available, we're going to have more cases come up in our county. How do I know if I've been exposed to COVID-19?
That's a really great question. So we talk about contacts of a case, and so that is close contact, and so that means prolonged exposure, being less than 6 feet apart to be exposed for kind of a more prolonged period of time, or again direct contact with secretions. And so whenever someone has a positive case at this point in time, because we are not seeing community transmission in our community at this point in time, which is good. So right now, the way that is addressed is when someone is identified as having the COVID-19 illness, we talk to that person and we find out who they have been in contact with during the time that they could have spread the virus. And so if someone has an infection, someone that they came into contact with 4 weeks ago, long before they contracted the virus, that person is not a contact in this particular light. This is looking at a contact who could have contracted the virus from the person with the illness. And so as we identify those, and by saying we, I'm taking credit with it for a whole lot of people. We have got stellar people here who are compassionate and very good at what they do and very knowledgeable. But as a team, they reach out and contact each of those identified contacts to let them know that there has been a potential exposure, and then with the advice of these are the things you look out for.
Yeah, and you mentioned secretions, just so people understand what all those are. Could you go into detail about that?
Absolutely. So that would be things like saliva or mucus. And so if someone blows their nose, coughs, sneezes, touches their face even, sometimes, there can be particles, microscopic particles. Nobody likes to talk about those things, but there's microscopic particles and body fluids on the surface of people's bodies. And so that's why diligent hand washing is a very good idea. And perhaps using some of these less appealing terms is maybe a good thing when we're trying to encourage social distancing.
Yeah. So you talked a little about it, but what should someone do if they know someone that knows someone that has tested positive?
Absolutely. So this is a really good question, and I've been thinking about what is the best way to explain it. And I'm going to do my best, and I might even try to explain it a couple different ways, because even at its simplest form, it still is a bit confusing. And so kind of the quick term for this is what we call here a contact of a contact. So that means that, well, I've been in contact with someone else who was a true contact. Whenever I say a true contact, I mean that is someone who we would be calling because they had a potential exposure to someone who has known COVID-19 illness. So I'll use myself as an example, obviously, here. So I have been in close contact with this true contact who was in contact with an illness, so a contact of a contact. So I have not been exposed. I understand how when we think about things logically, it can feel scary still to think about being in contact with someone else who was potentially exposed. But by definition, a contact is not someone who is infected. If they have the infection, if they are contagious and spreading the virus, they are a case, not a contact. And so being a contact to a contact does not put you at risk as far as we can tell at this time.
Okay, that makes sense, but it can be tricky, especially as more people are going to find out they've had some sort of connection. So
Absolutely. And it's probably a good thing to clarify that, again, we are not at this point in time seeing community transmission in our community. This has been seen in other communities as time has gone on. So I would love to think that we will not see community transmission here, but I'm not sure that that's realistic. And so we will be very forthcoming if there becomes cases that do not have a known exposure. That's whenever we would look at, is this just present in our community? And so when that happens, one, you will be informed about that, but it does change some of the ways we view this. The contacts, the contact of a contact, those guidelines and the way we view that is different whenever we think about a virus being spread throughout the community, which is not where we are at this particular point in time.
Yeah, so, there are guidelines for what to do when people are testing positive. So a lot of people have asked, why are positive COVID-19 patients not staying in the hospital after they get their results?
It is a really good question, and I think that people's feelings are very valid with the stress and anxiety and worry. And so I think that is an important thing to know, is that when we say don't panic and be prepared, this is not something that we take lightly. Your feelings are very valid. We understand why there is fear and anxiety about this, but even though the feelings are valid, they may not always be helpful. I think most of us can recognize that. And so trying to empower people with knowledge and reminding yourself of facts can really actually help with some of the stress and anxiety and worry that you may be experiencing. And so a fact, and again, whenever I just want to continue to reiterate that I'm going to give you the best information that I have at this point in time, knowing that information could change. And so at this point in time, 80% of people who develop COVID-19 illness, the disease caused by the virus, have mild to moderate symptoms, meaning that they do not need to be in the hospital. And we should make sure that we are able to provide that high level of care to people who need it. COVID-19 is not the only illness in mid-Missouri right now, and so I think that is an important thing to remember whenever so many of us are absorbed by this naturally, that for the 20% of people that need to be in the hospital who have this illness, we need to have a hospital bed for them. We need to have the staff to take care of them, and so that's kind of one piece of it. And then for the other people who need to be in the hospital for all of the other conditions that are present, some year-round, some this particular season, they need to be able to get the care that's indicated for them. On the other side of that, if you don't need to be in the hospital, you don't want to be in the hospital. I think it can be a reassuring idea to be surrounded by healthcare personnel and to have access to the highest technology if I were to need it kind of thought process. I think that's really logical thinking, but not not accurate in our healthcare system. We know that it is not good for the patient to be in the hospital if they don't need to be in the hospital. There are going to be exposures, not to mention for the people who need it, we want it to be available. So I hope that's clear, that it's not just us, it's not us triaging and saying, well, there's people who need it worse than you. It's really not in your best interest to get put in the hospital if it's not warranted.
Yeah, and another thing that has come up with people testing positive is why aren't the health officials giving more information to the public about those cases besides the age and why or how they got the virus, such as traveling.
Absolutely.
Yeah.
That is a really good point. And we do recognize that giving you as much information as possible is a smart idea, and we want to do that. We do care about you. I can assure you that every single person who works at this health department does so because they care about every citizen of Boone County. That's the whole point that you come to work here. And so that is our interest, is your well-being, and we want you to be informed. We are big fans of empowering people with knowledge here, but that has to be balanced with keeping a single person's identity and their personal information personal. Every person has a right to that, including each of you, and becoming infected with an illness or developing an illness does not mean that you lose the right to that confidentiality.
Yeah. So if I, am experiencing symptoms or think I have been exposed, how do I get tested?
That's also, all of these are great questions. It's like you did some research and got everyone's questions and put them together. So getting tested has become easier this week for sure for our community, and so there are several ways. Now there are a couple of drive-through testing sites, both at Boone and at University. The Boone Hospital site is just outside their ER entrance, and then the University testing site is in the parking lot, kind of their softball parking lot and Hearns parking lot. I feel like a lot of people know the Hearns Center, a lot of people know the kind of newer softball structure, so it's that parking lot. So those are two testing sites that I think are more convenient for people. You do need a provider's order. So that means an order provided to you by either a doctor or a nurse practitioner or advanced practice nurse or a physician's assistant. And so you would contact a provider, and we'll talk about some ways to do that as well, and have an evaluation done. And then they can help you decide if getting tested is the right thing to do. And then you guys can talk about where you want to be tested at that point in time with that provider. There are some online virtual visits that you can do. Some of those are even free. And then you can also, of course, contact your regular provider. I think that's still ideal if you're able to get in touch with your provider. Sometimes the right thing to do is going in and getting seen. Sometimes it's better to do a remote visit. It really depends on your circumstances, on your facility's policies. And so I'd recommend if you would like to talk to a provider that's not through the virtual visit, then contact that office, explain what's going on, explain your reason for a visit, and then they can help you decide if it should be a remote or a telephone or a video visit, or if it should be an in-person visit. And so there are quite a few providers here in mid-Missouri. We are fortunate for that. And so reaching a provider, having a mutual decision on is this the right test for you, and then discussing where to get tested. Of course, the ERs are, of course, able to test as well. The state lab is still doing testing if you meet their criteria as well.
Can we go over that criteria as it stands right now, what
Absolutely.
People are looking for?
Absolutely. So this is, you mean for the state lab?
For the symptoms and the requirements to get tested.
Sure, absolutely. So if you're going through one of the private labs in town, the requirement is that it's felt indicated by your provider who gives you the order. Typically, so that is provider dependent, so I don't want to speak for every provider obviously in mid-Missouri, but the typical symptoms are things like fever, cough, shortness of breath are the most common symptoms with this. You're at higher risk if there's a known exposure or a travel history to an area that has seen ongoing or what we call sustained transmission. So an area where there are more COVID-19 cases going on. So those would be a high-risk area. Some of those are within this country, some are international. So that exposure risk and then your symptoms play a big role. Again, at this point in time, those criteria will likely change with time. So that actually is the criteria. Those are the pieces of the criteria that the state considers to decide if you would qualify to have your test done through the state lab. There is a caveat within that for patients who are seriously ill in the hospital who don't have an alternative diagnosis. Then the exposure risk does not need to be there for that test to qualify the state lab. Again, that criteria is less specific, less rigid if you're going through not the state lab. So if you're going through one of those testing sites or through a private lab, then it's up to you and your provider to determine if that's an appropriate test.
Yeah. So we're going to switch gears a little bit and go into the city and the county ordinances that have been passed this week, and kind of what that means for people.
Okay.
So people have asked, what should I do if I see a restaurant, a bar, or an entertainment place that is not following the city and county guidelines?
Sure. So, and I am not sure I am the expert in this, so you correct me if
Okay.
if I answer incorrectly, because I definitely don't want to propagate misinformation. I think that is the last thing that we want to do, and I hope you all feel the same way. Please check your sources before you pass on a new piece of information. So if you see something that you feel like this isn't right, based on the ordinance that were just passed, and I'm concerned, we're all concerned about public health is the whole point of those, you can reach out and call our health department, and they get you to the right person when you call here. Is that right?
Yes, our environmental health department has been awesome working with the businesses in our county to make sure, everyone knows what the ordinances are and how to follow them.
Should we give them our phone number? Is that clearly
yes,
posted?
Do you
know it, Lucio?
We're gonna look that up so
sorry.
I don't get it wrong.
You're being so kind to me, and then I just totally
okay.
ask you a question that is completely off the cuff. So Lucio is going to get us that number, and we will get it to you. I am sure all of you, if you are able to watch Facebook Live, are also able to Google our phone number. So probably a moot point, but
yeah. And you're also welcome to always message us directly on Facebook, and then we also have an email address to make sure it gets in the right hands. So moving forward, a lot of people, this time of year is a big wedding season or parties and that sort of thing. So should people cancel their events if it's, as much as 8 weeks from now? Should they go ahead and start postponing and canceling?
If it's more than 8 weeks from now, or if it's within 8 weeks?
Within 8 weeks.
Yes. It pains me to say that. I know that is more than an inconvenience. But yes, the answer is yes. That is the wise thing to do, not just from a public health standpoint, but for your health, for your family and friends that would be attending that event. The answer is just yes.
Yeah, and from, we don't really know what the regulations will be in 8 weeks or how the situation progresses. Hopefully we will be in a very different place than we are now, but there's no telling. So being prepared as you can be now, I think, is really helpful for people.
Absolutely.
Are more regulations coming?
Probably. That is, I feel like I'm a bit underqualified in this area to speak to some of these things. So I think that when we look at the way the COVID-19 illness has evolved in other communities, I think it's most realistic to expect that it will probably happen here that way as well. We anticipate probably there will be more cases. I think it'd be wonderful, but highly unlikely that we don't see that happen. Our goal is to slow that process down, as we talked about before. That is really helpful for everyone, for our entire community, if we can slow that process down. But it is still probably going to happen. And so as that occurs, constantly reevaluating what our current guidance is, what our regulations are, how is that keeping the general public safe and our individuals safe. I mean, that's the point. Whenever we talk about the public, we're talking about each of you, each person in our community. So it's not just thinking about people as a whole, it's thinking about each person here and keeping them safe. And so, yes, regulations will evolve as guidelines evolve, or as we expect them to evolve. So I suspect so.
Yeah. And we will always keep you up to date. Not only the health department working, but the entire city is working together to make sure that businesses and individuals know what's going on and what we need to do to stop this spread. So with the ordinance, a lot of questions have come up on why there are certain exemptions. For example, daycares and schools has been a big issue. There are still those things that are closing, and so far it's been up to the discretion of that individual business or school. But why is there that exemption?
For daycare specifically,
Yes.
I think probably we're talking about here since the schools have made the decision.
Right.
Close, but the schools being an exemption from a regulatory standpoint,
Right.
Is that right? So there are a lot of pieces to each of these decisions, and so a lot of things are thought about before these types of decisions are made, recognizing that closing or changing how a business can run, or closing a business, that has huge repercussions, and the people who are making these decisions recognize that, and it's weighing what is best for the members of our community in light of this pandemic that is present. And so daycares specifically, that is tricky. A lot of people cannot go to work if they do not have childcare. A lot of those people work in healthcare. I should be able to give you, if I could give you a percentage, that would be very staggering. So I am not weighing in on whether daycares should stay open or closed. There's a lot of really smart people putting their heads together and looking at guidelines, which again may evolve with time, but that is a really tricky decision. And so having a blanket statement for daycares would be really challenging to do in the best interest of a community, because you may be kind of taking your legs out from underneath you if you take away all of your personnel to provide health care in the setting of a healthcare crisis.
And along with that, I think it's a good time to kind of address what we've seen so far with data as far as, children's vulnerability to the virus. If you could speak on that a little bit.
Absolutely. So for a lot of viruses, we worry about especially young children. Not that we're not worried about our young children with this illness. We are, just like with any illness. But whenever we think about high-risk populations, meaning people who are at higher risk for developing a more serious, people who are at higher risk of being higher risk of being in that 20% that develops a more serious case of the COVID-19 illness, those people have been identified as older adults. So some places you see over 60, some over 65. I think that there's not going to be an exact number. So recognizing that age is a factor whenever it comes to our older adults. We need to be really cognizant and be protecting them. Also people with diabetes or with chronic heart or lung disease. So I'm using that kind of as a segue to answer the question of, we have not seen children be at higher risk for serious illness. We recognize that anyone can propagate the transmission, so could develop the illness and spread that to someone who does have higher risk, and that's a big part of social distancing and of coming out with, of the CDC coming out with their guidance of trying to limit the spread. So we all play a role in that, in limiting the spread, even if we're not at high risk ourselves.
Yeah. So with the ordinance in place, a lot of people aren't going out as much, but they do, we do still have to go get groceries and food and things like that. So do I need to be wearing face masks or other protective gear when I'm going out in public, or even when I'm going to my job?
Thanks for asking that. Face masks really, at this point in time, appear to be helpful for people who are sick to wear. So if you are healthy, you should not be wearing a mask. If that guidance changes, we will let you know. We don't anticipate that particular piece of advice to change, though. So if you are sick, if you have symptoms of illness, you should wear a mask, but not otherwise. Good hand washing would be another key piece for people who are getting out and about.
Yes, and then we actually also had questions about goggles or gloves even.
Absolutely.
Yeah.
Thank you. So the gloves, gowns, eye protection, including goggles, and masks are recommended for people who are in really close contact and evaluating and testing these patients for the COVID-19 illness. That is not going to be a helpful tool if you are not in that particular setting. That answered okay
Yeah,
for you?
it did, yeah. And so then also with the ordinances out, and spring break was going to be this coming week, should I still travel on my spring break trip?
Probably not. So I just hate to do this to people. I don't want to tell you not to travel. I want you to have wonderful quality of life even now, but you just have to weigh risk versus benefits right now, and I would not be traveling. For your own safety, and then also because you care about your fellow community members and family members.
Yeah.
If you are traveling, please look at travel notices though, and so that is not my place to put a blanket statement and say absolutely no travel. So that is just my medical advice would be I would not be recommending people to travel, but sometimes travel is essential. But just make sure that you know everything that you need to before you travel. So if you do need to travel for whatever reason that is, then look at the CDC's website. There are lots of other websites as well. Sometimes it's overwhelming how many different places you can check, and so sometimes it's nice to have a centralized location. But the CDC is constantly updating their travel notices.
One of those places would be como.gov/coronavirus.
Yes, so to look
Thank you.
Yeah, to find, we have somebody in the wings here helping us out, Lucio.
Very helpful. Yes, thanks, Lucio. So our website here has links to these sources that I was saying can be so overwhelming on where do I go, and so Lucio and Ashton and their team here at the health department have really been looking at all of those sources for you and putting together the ones that we think can be most helpful, and they can be found at como.gov/coronavirus.
Yes.
Oh, and
Can I give them the phone number for the health department too, Lucio?
yeah, that's fine. It's 573-874-7355.
So if you didn't hear that, it's 573-874-7355.
Yes. And we are taking calls right now on that line, and we've had some very specific questions too, which we might kind of go over here. One of which is there's a lot of conflicting advice out there for people who may have asthma and use inhalers right now.
Yeah, absolutely. That's a really good point. And I think we're seeing that more and more as we start to see certain recommendations for people to not use oral steroids like prednisone or Medrol routinely in the setting of a COVID-19 illness. That doesn't mean that it's always inappropriate. There are certain times where it's absolutely necessary for people to continue breathing. And so that is something that your provider has to kind of help guide on when that's appropriate. But it is not recommended just on a routine basis unless it's really necessary. So when those recommendations kind of have started popping up, that has brought up the concern for people with asthma who take inhalers that have steroids in them. So some examples of those, just if you're wondering if you're someone who's affected by this information, would be things like Flovent, Qvar, Asmanex, Pulmicort are kind of the top ones that come to mind. I'm sure I'm missing a couple though. But if you have a maintenance inhaler for asthma, most of the time that is a steroid. That is not what these recommendations are talking about. If you are prescribed a daily or a maintenance inhaler for your asthma, it is prescribed because it's felt that you need that to keep your asthma under control. And now would be a really good time to keep your asthma under control. So I would recommend taking your medicines as prescribed. If you have additional concerns about that, by all means, contact your provider and speak to them about those. But on a routine level, for people with asthma, please go ahead and take your medicines as prescribed to keep your asthma under control.
So that actually covers all the questions that we had been getting overnight and common themes we've seen. So, Lucy, are there any comments on Facebook?
What can a worker do if they do not have the proper cleaning chemicals to kill surface contamination, nor the proper protective equipment? There is a back order on some of these commercial cleaners because they are being sent to those who face direct contact with the virus. Should commercial cleaning companies continue to put their workers at risk?
So I think, do I need to repeat that question? Was that clear on, do you want to kind of try to summarize, repeat
Yeah,
it, and
so
I'll speak to it?
in summarizing, I think, what can people do to be safe, especially as a lot of these cleaning products and things that we need to make sure everything is clean is not on the shelves all of the time. So what can...
So there are certain ways to be sure you're disinfecting appropriately for this particular virus. The links to that are on the website as well. Right?
Yes.
So that gives you kind of a more straightforward way to get access to that information. I won't read all of that to you because there's a lot of pieces of that kind of recommendation. So definitely look at the website if you're wondering what is the recommended way to disinfect and clean in light of this virus. If you are in a workplace and your workplace is not able to provide appropriate materials to disinfect or to protect you, and that's a concern, then I think that would be an appropriate time to call us so that we can, one, help kind of discern if there's something we can do to help, and maybe to kind of just discuss these are the different ways that it can be disinfected, and so we can problem solve with you.
Best interpreter ever, Shelby Harrison.
Yeah, I agree.
Let's see. If an employee tests positive, what are your recommended steps for making sure all employees are safe? What needs to be done once that person has recovered to return to work?
It's a great question. An extensive, really smart question, whoever had that one. And so can you break it down, Lucio? Can you give me the kind of the first one? What happens when they're positive?
The first part is what are the recommended steps for making sure all employees are safe?
Okay.
Before, from the medical point of view, as far as environmental health goes, I know we are in contact with everyone who is in direct contact with the positive case, and our team is working with the employer as well, so they understand the steps to take.
Absolutely. So that's kind of a big piece of this is kind of, so once an employee is identified as having COVID-19, if you come into close contact with that person, it would be just like if it had happened outside of work. Again, that's how this is being handled at this point in time. Guidelines may change with time as we see more cases, as we see it be community transmission. So I think that's important to clarify that the way cases are being handled right now could potentially change with time. But right now, we are not seeing community spread yet, and so once someone is identified and we talk to them, we identify those close contacts. So if you come into close contact with someone at work, you will be contacted by our health department, just like if you were a family member or a friend who had been in close contact with them. That's not excluded because it happened in the workplace. That is absolutely one of a whole group of questions that we ask for people who have this illness is, even in the workplace, who have you been in close contact with? So the people that have been in close contact are notified, and they're given specific instructions on how to monitor themselves as a contact of someone with the infection. From a workplace standpoint, that would be your primary kind of issue. It'd be us identifying your close contacts to that case, and then also if the person was at work when they had symptoms, and that is a big if. So I think that is an important thing for people to be aware of, again, with close contacts. Just because you've had contact with the person who has the infection, you have to think about when did that contact happen. If it was prior to them developing the infection, that is not the same thing as a contact. There's a lot of pieces to the puzzle. It's a lot for us to sift through here, and this is what we do all the time. And so not trying to overwhelm you with information, but I think that is an important piece of information. So the employer, though, would be notified so that they could ensure appropriate cleaning and safety of the other staff members if the person with the infection had been in the workplace while they had the infection.
And to reiterate, that close contact is within 6 feet for a prolonged period of time. So, we have a huge building here. If someone in the back were to whatever building, it wouldn't necessarily impact the people up front.
Absolutely,
yeah.
Absolutely. It would be unlikely that a single person having an infection would have exposed a large group of people.
Is it safe to eat takeout?
Yes, there is no evidence that this virus is transmitted through food.
In fact, we encourage you to still support businesses. You know, a lot of people have lost their jobs right now, but it's important to support, if you can, those people who are still working.
Absolutely.
Let's see. What info is there as to the length of time COVID-19 remains on clothing? It has been put out for surfaces and in the air. So, yeah, the main question is how long can it live on clothing?
On clothing, I have not seen that specific piece of advice. It may be, I don't even want to suspect that it may be the same as another piece of advice. We'll get back to you on that one, okay? Let us double check. We want to be 100% sure that we're giving you completely accurate information. And I did want to finish I missed a piece, I think, of that question. No, it wasn't you. Look at me touching. That was a terrible example of social distancing. So with the workplace, though, return to work guidelines, those can be found at the CDC website. And so return to work guidelines for someone who has been exposed or who's been a contact is different from return to work guidelines for someone who has the illness or is suspected to have the illness. So there are a lot of pieces to that decision. It is not straightforward. It is not black and white. It is but there's a lot of factors to consider. So it's not a gray zone. So I guess it is. It's just complicated. There's a lot of factors that you have to consider to reach the decision of when someone can go back to work. And so I think using the guidelines on there is probably better than me trying to give you each piece of that, because it's much easier to look at the chart or at the graph or at that recommendation and just find out where do you fit into that, or where does your employee or your employer or your family member or whoever you're looking for. It's probably easier than me giving you a rundown of every single situation. And you can get a link to that on our website.
Yes.
Someone just said they just got in late and they wanted to know if we can identify the people who are answering the questions.
Yes, so I'm asking the questions and helping out where I can. I'm Ashton Day. I'm a health educator here at the health department.
I'm Dr. Ashton Millham. I'm the medical director here at the health department.
And we have the amazing Shelby helping interpret for us as well. And for those that have come late, we will keep this on our Facebook page. We'll post it, and the city will also have a video on the coronavirus website that we have, so you can always go back and check things.
There's another one in here, but I don't know if there's an answer to it yet. How does someone get tested if they do not have a primary care physician nor a car to go to any of the drive-through clinics?
Absolutely. So that's a really good point, and that's great. Yeah, we are working on this. So I'm going to kind of split that apart. So if you don't have a primary care provider, you can still be seen at clinics. If you're specifically concerned about COVID-19, you don't have a primary care provider, it makes the most sense, in my opinion, probably to do a video visit. Limits your exposure, and probably quickest way to get that done. And so they're offering the free video visits right now if it's specifically related to COVID-19, and then you'd be able to do the drive-through testing as well. As far as if you don't have a vehicle, we are working on that. If you think you need testing and you do not have a vehicle to get to the test site, or would really not be getting to the test site, it'd be going through the test site without a vehicle would be kind of your barrier, and you don't have someone whose either vehicle you can borrow or who will take you, then that would probably be appropriate for you to give us a call, because we are actively working on that. We do recognize that people who are maybe more vulnerable even prior to COVID-19 are disproportionately more vulnerable now with all of the changes that are going on to protect the public. It is more than an inconvenience. Like I said earlier, we recognize that we know that this means some people are going without income, struggling to put food on their table and roofs over their heads. This is something that we, again, taking credit for so many people here, so we meaning the health department, so this is public health and human services, and so there are a lot of people here, and again, I assure you they are here because they care about each person who lives in Boone County, and they are all working incredibly hard to figure out how to keep people safe and to address all of these basic human needs concerns that are even bigger in light of what's happening right now with the pandemic.
I think this is a good time to mention we are working on all of these different resources, gathering them. We will use our como.gov/coronavirus website to be the central hub for all those things. So not only can you use those resources, that page to find resources, you can also find resources where you can help if you are able in any way that you can.
Yes, that's a great time to bring that up. Yeah. That's really wonderful. So many people, this is kind of feeling like I'm making it a little dismal because it's a pandemic, and not to make light of that, but a lot of people are stepping up, and we're really seeing this amazing side and how amazing our community is. One of our meetings yesterday, we were talking about the things that have happened so far to meet these basic needs. This wouldn't happen just anywhere. So kudos to the members of Boone County for really stepping up in a time like this. And having a coordinated effort whenever you want to help is tremendously more effective for people who need your help. And so once again, I'm going to reiterate that because that's a huge, I think a lot of people want to help out, and thank you. We would love for you to help out too. There's a variety of ways to do that, but doing that as a coordinated effort is going to be ideal for everyone. And so going to the como.gov/coronavirus, and then you can find the link to can we go ahead and talk about the Give Help? It's
not up yet. But,
so there will be a really specific link, but you can still go to that website and can find the link to the volunteer page. The como.gov/volunteer page is up and running and being coordinated, and so that is a really great place to start. And then they're actively working on constantly updating the website, and you can hear us talking about right now is that up and running? I mean, they're just doing phenomenal work, getting every possible resource available as soon as it is available.
Yeah, but there will be sections on that COVID landing page called Get Help and Give Help, where people who want to volunteer or donate, or if they need help, it'll all be right there on that landing page.
Perfect. Do you think that got picked up? There, you want to repeat
it? If it didn't, just read it.
Just to reiterate, so we make sure everyone can hear it, there will be specific links on that webpage that say Get Help and Give Help, so that if you are able to donate, volunteer, anything you're able to do, we'll get you in touch with the right people to do that.
For volunteers, it's como.gov/volunteer/COVID.
Perfect. So that was como.gov/volunteer/COVID if you specifically would like to volunteer for the efforts going on to address the needs kind of created by the pandemic.
And I think that's a good place to stop for today. Unless we have one more.
Yeah, what are some best practices for keeping ourselves safe, even if we have food from restaurants or groceries delivered to our homes?
Absolutely. That's really good. And thanks for doing that. So having things delivered is a really good idea. If you're able to do that, that's wonderful. You can support businesses that way. You can keep yourself safe and healthy that way. So kind of ways to do that in safest way possible. I know a lot of those kind of companies or organizations that provide those delivery services offer for you to ask someone to leave things on your doorstep, let you know whenever they're there, but you don't have to have direct contact that way. Certainly practicing social distancing still. Again, that's that 6 feet is kind of the magic number as far as we can tell right now. If you are going to greet the person at the door, please keep 6 feet distance for their sake and for your sake and your family's sake as well. Great hand washing is still just number one. Cover your cough or your sneeze and wash your hands really well, and use hand sanitizer with at least 60% alcohol in it if you don't have access to soap and water to wash your hands well.
Find a cool hand washing song.
That's right. I think that's a good thing to talk about. We often think about Happy Birthday song twice. I think I saw Twinkle Twinkle Little Star the other day. I didn't actually double check to see how many seconds that was, but At KBIA last week, she said she chooses a different Lizzo song. So to appeal to probably more of our social media users, find a song that's about, or a chorus or a piece of your favorite song. It'll be 20 seconds. Let's make it fun.
Right.
I like Staying Alive.
Hey, that's great. I love it. Yeah. So maybe you guys can share with us some favorite. Is that something we can do on social media? Share with us your favorite songs. Let's make hand washing more fun. That's kind of something we should all be doing as much of as possible right now.
Okay. Or if anybody has suggestions for things to do while you're self-isolating.
Absolutely. It can be a platform for things to do while you're self-isolating. And I think that, we'll be coming back with lots of topics. Can I talk a little bit maybe just like stress and anxiety kind of self-care things? And so clearly we are fans of staying informed and keeping you informed, and social media being a tool to do that. But it is really important to take breaks, especially if you are feeling stressed or anxious right now. Again, those feelings are valid. We understand that. It is important for you to take breaks and take deep breaths. That sounds so simple, and it is, but it is incredibly helpful. We are working on compiling a more comprehensive list of mental health resources to help people who have more significant symptoms. Right now, if you have significant symptoms that are lasting more than a few days, or several days in a row and are affecting your ability to do your daily activities, or if you're having more serious thoughts, contacting your healthcare provider. You can also call the Burrell Crisis Line, again, specifically for mental health concerns. And again, we have a really great team here who is there's a group of members who are specifically looking into mental health resources to compile a list for anyone who needs it. But taking breaks, taking deep breaths, that is really important. And then staying connected in ways you can, not just with social media, but call and talk to people on the phone, connect with video chat with family and friends. Taking breaks from social media and from the news right now, I think, is really important for mental health and for self-care. That doesn't mean you can't be connected in other ways. Those video chats, those telephone calls for people that you would normally get to see in person can be really helpful for both you and the person you're reaching out to.
Yeah, I think that's so important right now, especially. What's that? Sorry.
We do not have any new questions.
Awesome. All right. Well, thank you everyone who submitted questions. Thank you both for being here.
Thanks for having me.
Yeah, this was great. We will continue these chats every weekday, noon to 1. Try and keep it in that lunch hour for people to catch it. And then we will be posting on our Facebook as well as on our website. And if you have any questions that come up anytime, you're more than welcome to message us on Facebook, call the health department, or email us.
So the email is coronavirus@como.gov.
The email is coronavirus@como.gov.
573-874-7355.
Okay, and the phone number is 573-874-7355. All right, thank you so much for tuning in, and we will see you all soon, and we will continue to keep you updated on those platforms. And on the website, como.gov/coronavirus. All right, thanks.